When a patient suffers a traumatic brain injury, it's important to know how to recognize the signs and get the right care. Neurologist Shawn Babur and the team at Community Neurosciences Institute provide the highest level and most comprehensive care in the Valley to diagnose and treat traumatic brain injuries or TBIs. A traumatic brain injury or TBI happens when a forceful blow jolts the head or body and affects how a patient's brain works.
Like the most common ones we see typically are head injuries, so falls are a big one. Another is a lot of motor vehicle accidents. Patients will come in with traumatic brain injuries of various severity.
Dr. Babur sees mild to severe TBIs from sports-related concussions to trauma or combat-related injuries.
Kids playing sports, a lot of that can come from a lot of athletic play. Certain occupations like military veterans, a lot of them will have traumatic brain injuries as a result of their exposures over the years.
Babur says in dealing with any kind of TBI, it is important to seek medical care as soon as possible, as a brain injury is not like other injuries on the body.
At CRMC, we have a very comprehensive neurosciences program. It has been thankfully been invested in heavily by the administration, and we have a strong team here. We have several neurosurgeons who are on call, and we have the neuro ICU. We have trauma surgery here who are very well equipped and have a lot of experience in dealing with these types of patients.
If you suspect someone has suffered a TBI, there are some simple steps you can take.
You want to do a quick assessment, you make sure everything's okay. If you have any concern that things are not okay, usually come in to ED, get scanned, get observed, and make sure they're stable.
TBI symptoms to look out for: headaches, nausea or vomiting, memory or concentration problems, a dazed appearance, or loss of consciousness.
It doesn't sound like, they're dazed or they're really confused, like they know who they are, they know where they are, they know what's going on, they can tell you everything that happened during that day, especially the events surrounding what happened before, during, and after. So you want to make sure that basically they're still the same person.
In the end, it can be hard to recognize a TBI, and Dr. Babur says education and prevention are key.
One of the things we like to say in the TBI field is no two TBIs are the same. So people can have a TBI that from the outside looks exactly the same mechanism, same injury, but the person experiences it differently. One is always to be vigilant about these types of injuries and how best to prevent them.